Welcome to the Round 2 Applicant Webinar. I am Rose Lee, Director of the A2 Coordinating Center, and I'll be moderating today's webinar. I want to also introduce Dr. Rebecca Krupenovich, one of the NIA program officials for the AITC program, to welcome you with some introductory remarks on behalf of our sponsor, the National Institute on Aging, or NIA. Rebecca?
Thanks, Rose. Hi, everyone. Thank you all for joining today. So the AITC, or A2 program, aims to promote research and infrastructure development in artificial intelligence and technology towards enhancing the health and well-being of older adults, including people living with dementia and their caregivers. So this program and these pilot awards are a really unique opportunity to advance our understanding of how these AI and tech tools can improve care and health outcomes for older adults, especially in this current fast-moving AI environment. So congratulations on making it to the second round, and we're looking forward to seeing your innovative and impactful ideas.
Thank you so much, Rebecca. For the current competition, we received almost 200 applications for pilot projects. Over 55% of the applicants to the third annual competition are managed by a startup or small business, which may or may not have existing collaborations with an academic or other nonprofit or for-profit partner. If you were invited to join today's call, you are part of the select group invited to advance to the second round for final consideration by one of the AITCs for funding. Almost half of the invited round 2 applicants are led by startup or small business. So our goal today is to highlight and address areas of possible concern in the round 2 application process and provide tips to help you formulate your most competitive application. We'll spend about 5 minutes on application resources and evaluation criteria, about 15 minutes quickly reviewing application components, and about 15 minutes on application tips and what you can expect post-application, before opening it up for about 20 minutes of questions. Please hold your questions until the Q&A portion, and remember that we're focusing on the application process today rather than specific questions about your individual projects, which should be probably more appropriately directed to the AITCs offline. This video call is being recorded, and the plan is to post the recording on the A2 Collective's YouTube channel, which is unrestricted, minus any applicant Q&A. We'll also plan to post this slide deck for your future reference. Okay, next slide. The following representatives from the AITCs are on the call today to take your questions. The PIs of the AITCs and Coordinating Center are highlighted in orange font. We've also listed 3 of the NIA program staff that we expect to be on the call today as well. All right, we wanted to remind you about the remaining key dates on the relevant timeline. After today's webinar, the round 2 applications are due October 30th by 5 p.m. Eastern Time. Applicants can seek additional consultation with AITCs to develop their round 2 application. The goal is to finalize the awards, which requires NIA review and concurrence by the spring of 2024. You should expect to get some indication of the AITC's decisions around mid-December. And the plan is to provide timely feedback to all applicants, however brief. Okay, looking next at the evaluation criteria, just as in round 1, round 2 evaluators are asked to consider a number of criteria and to provide an overall score and comments. And those criteria are significance, innovation, approach, commercialization potential, investigators, and environment and resources. AITCs may give additional consideration to projects that leverage their resources or facilities or generate data sets, software, or hardware that might benefit the AITC research community at large. Other areas of consideration might include go-to-market strategy, regulatory reimbursement pathways, and mitigation of health disparities across the United States, including improving access to and delivery of care in rural areas. Please note that any project that has been awarded SBIR, STTR, or any other NIH research funding for the same or very similar work is not eligible due to overlap. Dr. Kayla Har will address this and other components of the application in more detail next. Kayla?
Thanks, Rose. So I am going to touch at least briefly on all of the round 2 application components listed on this slide, but in particular, we'll discuss data and resource sharing, budget, human subjects, and ethics in more detail. So before we get into those, I do want to highlight some key points about the other application components, which are generally similar to or expansions of what was requested in the round 1 application. In the first section of the application, you'll be asked about overlap with other federal funding. If you are unsure whether your proposed project might overlap with prior funding received, please discuss that with your AITC before submitting the round 2 application. If you are under consideration for other funding currently, be sure to disclose any overlapping awards as soon as they arise. In addition, do please review the conflict of interest reference list that's provided in the application again, and make sure that you evaluate whether your project team has any conflicts that have emerged based on changes to the team that have occurred since you submitted the round 1 application. Conflicts do not disqualify you from funding, but it is critical to inform us of them to ensure a fair review process. Do note the page limits for the specific aims and research strategy, and please do not exceed them. Citations and letters of support are not required in the round 2 application, but they can be included optionally, and they do not count toward the page limit. Projects can be proposed by a single applicant institution, or they can involve multiple institutions in collaboration, in which case one institution is designated as the prime applicant institution, and if funded, would make subawards to one or more other institutions included in the application. For multi-institution projects, please keep in mind that all pilot project work must be completed in the United States unless foreign clearance is obtained from NIH. So if your project does include a component that would require foreign clearance, we recommend that you discuss that with the AITC prior to submitting your application. The project must have a PI who will function as the contact PI and is associated with a US-based prime applicant institution for the project. So if your project involves multiple institutions collaborating, co-PIs and MPIs can come from subaward institutions, but they cannot serve as contact PI for the project. Multi-institution projects should also begin intellectual property, IP negotiations early and plan to have them resolved prior to confirmation of funding to avoid delays in starting the project. Also be aware that multi-site pilots selected for funding will be subject to a single institutional review board, IRB, requirement if they involve non-exempt human subjects research. Per NIH policy, pilots funded by the AITC program are expected to share non-proprietary pre-competitive data. The round 2 application includes submission of a completed A2 collective data and resource sharing plan agreement, which asks applicants to describe the data that will be collected during the pilot project and indicate plans for data sharing. We do understand that the data collected will vary significantly across projects, as will the nature of the data that can be shared. Thus, to ensure productive sharing of some quantity of data, the AITCs are developing a set of top-down common data variables that funded pilots will be expected to collect and share. The AITC Data Integration and Quality Core is leading that effort, and I'd like to invite the director of that core, Dr. Chris Shute, to provide some insight on data and resource sharing expectations for pilots. Dr. Shute.
Thank you. I'm Chris Shute from Johns Hopkins. The point of the data commons is to provide a forum where pre-competitive data could be stored and shared among our colleagues for purposes of benchmarking, for purposes of making all boats rise together, and consistent with the goals of AI analytics going forward from a data-centric perspective. We recognized in our first rounds that the notion of submitting data that was convenient to be submitted did not yield a large, reusable, refined content. So the committee is working to potentially identify what might be shared among all the applicants in terms of prospective data suggestions, probably on the order of survey information about the patients with respect to cognitive status, with respect to functioning, and perhaps with respect to diagnostic and medical history. The goal is to enable sites to potentially broaden their analytic capability, to compare their cohorts with other cohorts, and to leverage data of your colleagues in a pre-competitive way that would allow enhancement of your own understanding of the distribution of your patients and benchmarking with others. In no way are we expecting the submission of data that you would consider to be proprietary or that you would consider to be an integral and critical component of the information that you would ultimately propose to commercialize. Happy to take questions later.
Thank you, Chris. In the round 1 application, you were asked to provide an estimated total budget for project direct costs, which cannot exceed $200,000. In round 2, you'll submit an NIH detailed budget that itemizes those project costs. So the round 2 application includes a fillable copy of that detailed budget form, as well as an annotated version of the form for you to download and reference, which is what I'm displaying here. The detailed budget contains 2 pages, a budget for direct costs that's labeled form page 4, and a checklist form page used to indicate facilities and administrative or F&A indirect costs, rate, and base. If you're a single institution applicant, then you'll complete both of these pages. If your project involves multiple institutions collaborating, then you'll need to submit a detailed budget and budget justification for each of the institutions involved in the project. For JH-AITC and Penn AI Tech multi-institution applicants, only the prime applicant institution should complete the checklist form page, which includes space to indicate the prime institution's indirect costs, base, and rate. The prime institution also lists any subaward institutions' indirect costs in the consortium contractual F&A line on the detailed budget form, which is the last line that's circled on the first page of this slide. Collaborating subaward institutions that are applying to JH-AITC or Penn AI Tech would not complete the checklist form page, the second one that's shown here, but they would submit the detailed budget, the first page here, and list their own indirect costs or F&A costs on that detailed budget form. And then in their budget justification, which I'll talk about in a moment, they would list their indirect cost rate. For Mass AITC applicants, do note that some differences apply in how Mass AITC plans to structure awards, which impacts how Mass AITC multi-institution applicants should complete these forms. And Mass AITC has already provided its applicants with specific budget instructions that address those differences, and you should follow up with the AITC if you have further questions about those. When you are working with these forms, you might notice that the budget forms are labeled as approved through February 28, 2023. However, no updated version of these forms has yet been released, so the prior version of the forms does remain in use until NIH issues an updated version replacing it. As I mentioned, applicants also must submit a budget justification that provides detailed explanation of the costs included in the detailed budget. So we have an example budget justification available to illustrate the format and level of detail required. And again, if you're a multi-institution applicant, each of the collaborating institutions should provide its own budget justification, and the subaward institutions can state their indirect F&A rate in the budget justification. Do note that if your institution does not already have a federally negotiated F&A rate, you must use the de minimis F&A rate of 10%. It's also important to note that any small business innovation research or small business technology transfer rates from past experience do not apply to this program, and SBIR, STTR policies do not apply to our program. The application also contains questions about human subjects research that were part of the round 1 application, but should be revisited and considered carefully in the context of the study design you're proposing in your round 2 application, which might have evolved somewhat from the round 1 application and may continue to evolve in consultation with the AITC. I'll discuss human subjects research briefly as we provided a short video covering these policies and additional tools in more detail that we encourage you to view if you have not already done so. And we'll also share the link to that video again here. For all of the questions on the application about human subjects, we provide links both on the application and in these slides that define human subjects research, exemption, and clinical trials, and will help you determine how to answer these questions. A few key points to note: if you believe that you're conducting exempt human subjects research, it still must be reviewed by an IRB and confirmed to be exempt. So if you do not already have an exempt determination from an IRB, but believe your project is exempt, you would answer that question about having an exemption, no, and then you would have the option to pursue an exemption determination after being approved for funding. Pilot awardees will also be able to access the A2 Collective subscription to ADVARA training, which can satisfy the NIH requirements for PI training on human subjects protection, and pilot awardees may be eligible to use the AITC program's central IRB. Do note that clinical trials are not eligible for funding in the 3rd annual A2 Pilot Awards, and that does mean that no part of your study design can fall under the NIH definition of a clinical trial. The application includes a series of questions to help you confirm that your proposed project is not a clinical trial. If you are not sure whether your study design involves human subjects, may be considered exempt, or constitutes a clinical trial, NIH provides a wealth of resources to help determine that, and you can also discuss your study design further with the AITC that's invited your round 2 application. A new component of this year's round 2 application is a series of questions that ask applicants to engage in ethical consideration of their proposed research. Dr. Emily Largent and Dr. Anna Wexler of the Penn AI Tech Ethics and Policy Core are joining us today to provide additional insight about those questions and what reviewers will be looking for in the answers. So Dr. Wexler and Dr. Largent.
Great. Thank you so much for letting us join you today and talk about these questions briefly. So in terms of ethics questions, these have really been incorporated because even the seemingly most straightforward research questions can require you as an investigator to make decisions about how you'll design and conduct your research, and those, whether implicitly or explicitly, entail ethical judgments. And so what we found is that, these are potentially more loaded even than in other circumstances because we're working at the intersection of 2 areas that come with their own ethical considerations. So obviously, when we think about AI and digital health, there are a lot of considerations there. And when we think about older adults, particularly those who might have cognitive impairment caused by Alzheimer's disease or related dementias, they could be vulnerable and have their own considerations that we need to think about. Additionally, there are often health disparities in this space. So the questions we've put together have really been intended to help prompt your thinking in advance of starting your research about various issues that have routinely come up in past studies and systematize how you're thinking about that. And so they're brief answers, and it really is just a chance for you to reflect so that we can proactively get ahead of that. Successful applications will eventually be submitted to an IRB for review, and that will be to ensure that they satisfy regulatory requirements, but also that they satisfy ethical requirements. And so we're hoping this is a good head start.
Thank you very much, Dr. Largent. So here on this next slide are some of the resources related to human subjects research that I mentioned, including NIH definitions and decision tools, and the video containing additional guidance on human subjects research. Also included is a link to a publication by Drs. Wexler and Largent that outlines key ethical considerations for developing and testing minimal risk devices, and that's available full text online free. These slides will be shared early next week, along with a link to the recording of the webinar that will be posted to the A2 Collective YouTube channel, so you will be able to access these links and resources directly. I want to close with some key reminders to keep in mind as you complete the round 2 application. So always remember that you can find answers to additional policy and application questions in the FAQ on the A2 Pilot Awards website. We'll also add any new questions that emerged today not already addressed there to the FAQ after the webinar. You can also find all the templates, examples, and reference materials relevant to the application, both in the resources section of our website and embedded in the application itself as downloadable resources or links. When you are completing the application in the Accelerator app platform, note that all uploads are PDF only, and you can only upload 1 file per upload field. If you try to upload additional files through the same field, it will just replace what you previously uploaded. So for multi-item uploads where you're combining multiple budget forms or bio sketches, please combine the documents into 1 PDF. And for the fillable budget form, we recommend you print to PDF in order to avoid any conflicts across live fillable form fields. Applications must be submitted via Accelerator app by 5 p.m. ET, and that's Eastern Time on October 30th. We do encourage you to submit early rather than waiting until a few minutes before the deadline in case of any technical difficulties. And if you do encounter technical issues, you should contact us immediately at support@a2collective.ai so that we can help get your application submitted prior to the deadline. You can also write to that support address with application or submission platform questions. For questions that are about your individual project or AITC specific policies and resources, please contact the AITC inviting your application. And with that, I will turn it back to Rose. Thank you.
Thank you, Kayla. So next, each of the collaboratories are prepared to provide guidance on design and conduct of interdisciplinary projects, assembling appropriate investigative teams and evaluation plans. All are well-versed as well in human subjects research. Some of the AITCs also offer access to diverse patient populations. So in this slide, we show all the PIs for the A2 collective. The PIs expected on the call are framed in yellow. I was going to begin with Mass AITC, but I see Deepak could not join us. So Ben Marlin, who is an expert on AI, machine learning, and statistics, and who leads many of the Mass AITC core activities, will be speaking on behalf of Mass, and then we will turn to Hopkins and Penn. So Ben?
Yep, thank you, Rose, and welcome everyone. We just have a couple of quick items to mention. So with respect to the preparation of pilot packets, as Kayla was mentioning, Mass AITC does differ in the structure of the budgets that we use for multi-site awards. So I think some information has already been disseminated to the teams in that regard. The main point there is just that for multi-site project teams, Mass AITC issues subawards directly to each site. So we don't use a nested budget structure, and we found that to be helpful, particularly for project teams that involve a mix of academic and industry partners. So that's something to keep in mind as you work on preparing your submissions. In terms of questions as people go forward, I wanted to mention that we use Airtable as a primary mechanism for collecting questions from pilots. So again, that information has been disseminated out to folks already as well. So for Mass AITC pilots, please contact us through Airtable if you have questions, and we'll use that mechanism to route your questions back to the most appropriate person to address the issues that you're inquiring about. I think as Kayla also mentioned, one of the issues that we've seen, just in terms of a tip for project teams getting off the ground post award decision is around intellectual property and intellectual property rights discussions. So again, for academic industry collaborations, it's particularly important to start those discussions early. So for multi-site teams that involve a mix of different kinds of participants, or again, multi-site teams with 2 academic sites, it really is important to start those discussions and have a good idea of what that's going to look like, even as you're preparing documentation for this round. So that isn't specifically requested, but is something that you should be working on sort of in the background at the same time, so you're ready to go if you receive a funding notification eventually. So I think that's all I've got for this piece, Rose. Back to you.
Okay, thanks, Ben. Turning next to Hopkins AITC, Jeremy Walston.
Hi, everybody. I'm Jerry Trishan. Have worked for a long time with older patients and in the healthcare facilities, trying to keep people independent and able to do as much as they can for themselves as long as possible. So this has been a great new approach for us. And I think our combination with our engineering colleagues here at Hopkins with us in geriatrics has been a great new way to think about new products, new approaches, new technologies to kind of keep people at home as long as possible. So one of the things that we have dealt with in the first couple years of this award is people who are applying from it are from a large kind of different disciplines, everything from very technology company related things to sort of more traditional academic clinical programs. And so one of the things that I just want to encourage everyone who's applying for this is to really think carefully about the application and make sure that the forms that they're doing are kind of accurate for NIH applications, even if you're working in a company and haven't really applied for NIH programs before. We can help you over the next couple weeks as you think about this, and can help you sort of make sure that you're doing it in a way that is viable and readable for the folks who are going to be reading your applications moving forward. I think just wanted to say to all of you who have applied, I think it's super important work that you're doing, that this field in general is really rapidly progressing, and this new NIH funding award and our programs at Hopkins, at UMass and Penn, I think are really excited about moving this work forward and helping you put in applications that can be funded. And even if it doesn't get funded, to help you think about directionality in future programmatic development that could be very helpful to older adults. So I will stop and just thank you for your applications and for your interest.
Thank you, Jeremy. Turning next to Penn AI Tech, Dr. Kathy Bowles will speak. She co-leads the Penn AI Tech pilot projects.
Thank you, Rose. Hi, everybody. Good afternoon. Well, we've really enjoyed working with the first round, the second round. There are years of grantees, and so we're really looking forward to this third year with all of you. Our collaboratory is unique in that we are closely linked with the School of Nursing. So I'm a professor in the School of Nursing. George Demiris, our PI, is also a professor in our School of Nursing. So we've got that perspective to share with you. For those of you that don't have a clinical background, that expertise has really come in handy to understand your applications and how it affects humans. We're also closely affiliated with the New Cortland Center for Transitions in Health, which is a large successful research center at the School of Nursing as well. We held office hours to help the people as they were preparing their applications in round one, and we stand ready to assist you throughout this process as well. We ask you to be sure that your projects are feasible. They are one-year projects, so that's a lesson learned from our previous years, to be sure we're not being too ambitious and unable to complete the project in 1 year. So keep that in mind. The other piece of advice from us is about budgeting. So consider budgeting for research assistance. If you are enrolling patients and collecting data, primary data for your work, definitely need to have research assistant help. And then the third thing I wanted to say is, if you need a site to collaborate with, a clinical site, or you feel you are going to use resources at Penn, we need to know that. We need to know in your application that you have already arranged those collaborations, and we can work with you to help you think those through and make connections. So those are basically my messages today, and I wish you all really good luck.
Thank you so much, Kathy. Don't go away. Focusing next on the post-application process, we wanted to give each of the AITCs a chance to comment on what applicants can expect to happen before and after October 30th. For example, some AITCs might want to schedule interviews with particular applicants, solicit answers to questions by email, or hold office hours. All applicants can expect to receive some feedback by mid-December. So we're going to have the AITCs go in reverse alpha order, beginning with Penn AI Tech. Kathy?
Okay. I was just going to ask Jennifer to help me out with this one, as what our plans were for going forward and interacting with the applicants for our third round. Jennifer, are you on? Thank you.
Happy to take that. So the applicants are all reviewed by 3 different people. One of which will be looking at the clinical side of things, and one who will be looking at the technological side of things. And then a third person and the group will come back with their feedback. And in that, if we find that there are some questions that need to be answered, then we'll reach out directly and check in with the applicant for that information. And then we basically give the reviewers about a month to do their reviews and to compile that data. And then our core team, which is the 2 co-leads for the ADRD core and the 2 co-leads for the healthy aging core, will come together along with Dr. Damaris to put our best applicants forward.
Okay, thank you, Jennifer. Turning next to Mass AITC. Ben, are you the right person to speak on this?
Yes, thank you, Rose. Yep, so on the math side, again, I think we mentioned already, and it's shown on the slide, if folks have any questions in the process of preparing their applications, please reach out to us via Airtable. So as I said, we can route your inquiries in the right direction. If there are other opportunities, office hours and so on, we will let people know over email as those become available. In particular, if folks have questions about accessing Mass AITC resources, as was mentioned earlier, please do let us know. If you're still looking at teaming, let us know as well. So if you're looking for a particular expertise, we can still potentially help to make some connections along those directions as you're preparing your applications. In terms of the post-application process, so just a couple of comments on the sort of post-selection phase. So as Rose mentioned, we will get feedback back to everyone on proposals. For proposals that we select to move forward to NIA, folks should be aware that there is additional documentation beyond what's required for this round at that point, including much more extensive human subjects documentation that will need to be prepared. So post selection of pilots to go forward, we'll be working with everyone closely again to get those final packets together. That's a fairly compressed time period as well. But again, we'll be in touch with folks very quickly after we make selections to get that work up and running. So thank you, Rose.
Thank you, Ben. Okay, turning next to JH AITC, Jeremy.
Hi. So I think I kind of mentioned that in my first set of comments. It's like really important to follow the kind of instructions and the forms. And I think it's especially for groups who haven't worked with NIH applications before. There's some very specific rules and things that need to be followed. So we're happy to talk to you about that in the coming month as we get that together. I think it will help the review process. And then if you make it to the final recommendation, then with the NIH, it'll be very helpful to kind of have it put together accurately. So again, we're all happy to work with you on that. And then sort of the post-application process, again, there's just a number of steps that take place at each of our universities to get them approved and then to get back to you. So it does take a little bit longer than sort of a rubber stamp approval. So I just want to have people be patient ahead of time, talk to us a lot about it, understand the processing by which the forms have to be filled out and then approved at the NIH after the individual groups approve. So Again, we're open for questions, and Wicker is our main kind of individual who would speak to you and then sort of send you in the right direction if you have specific questions about your applications getting to the end of October.
Thank you, Jeremy.
Sure.
Okay, and should you be so lucky as to make it to the finalist round, we wanted to manage expectations and share this chart, which kind of documents, depending on if you have human subjects, what the rest of the just-in-time submission would constitute. So we want you to recognize that if you're a finalist, you'll have to submit additional documentation prior to award. And this shows, depending on your human subjects participation, what those requirements are. We're here to help you with this. And we know that for especially small businesses that are new to this part is probably quite challenging in terms of figuring out how to fill out these forms and what to include. And this is all part of what the AITC has to submit to the NIA for final approval. Okay, finally, this slide, again, you've seen this, but we've added the contact links on the bottom. The contact information is if you'd like to follow up with the AITC directly with questions specific to your project.